Hi everyone, my name is Ashley McGrath. I'm an employment-based PhD student working with the Irishman Sheds Association, and I'm funded by the Irish Research Council. My role essentially is involved in the implementation and evaluation of a community-based men's health and wellbeing programme. It's called Sheds for Life, and we bring that to the men in the sheds. I'm just going to talk to you a little bit about that today. So Sheds for Life essentially is a 10-week intervention. It consists of a health check, which is very much a hook for the men. And then there's three core pillars. So we've got mental health, physical activity, healthy eating, as well as some modular components. So the men get to self-select into it so they can tailor it to suit their shed and what their shed needs, which works quite well because it's meant to be an autonomous and kind of informal approach. And so they will select things like CPR, diabetes and cancer awareness, Safe Talk, which is a suicide workshop, and other different components. Digital literacy as well, which is probably going to be a big one going forward in light of COVID. And Sheds for Life works in a partnership approach. So we develop Sheds for Life in collaboration with the key stakeholders. And that very much means the men's shed members themselves. So we engage them as partners and participants in the research. The Irish Men's Sheds Association is an organisation, our funding bodies, partner organisations who deliver the various components of Sheds for Life. The goal of the evaluation is very much a hybrid approach. So we look at testing both the effectiveness and the implementation. Essentially, this means what we want to show is that Sheds for Life works in its impact on the men, but also we want to understand the best way to implement Sheds for Life so the model can be sustained and translated across the different contexts of the sheds, because they're all so variable. And that means looking at implementation outcomes. So we look at things like acceptability. So, are the users, I suppose, satisfied with the program? Its adoption. Do the providers buy into it and share the goals and the agendas? Appropriateness. Does it fit the environment? Is the relevance perceived well by the men? Does it respect the shed's environment, or does it undermine it? Looking at costs as well, so understanding, is it effective in that way? Feasibility, so is it realistic to implement it in different localities? The fidelity, so really much maintaining the core objectives of it, making adaptations to suit the different contexts, but also keeping, I suppose, the essential essence of what the program is about. Penetration, so do we get to the men that we really want to get to, those hard to reach group of men? Sustainability, can the program work going forward? And I suppose it gives us an insight into our intervention then, and a lot of the time it can help us to understand if something is ineffective. Is it the intervention itself, or is it how we implement it that's actually limiting its impact? So we look at different levels to understand that. So we look at the individuals, what are their previous experiences, their attitudes, what motivates them. The provider level, so do we share our goals? Can we align our goals with our providers? Our organisation, so do we have the admin support? Is the capacity there? Are we ready to implement? Looking at the larger community systems level as well. What are our politics, our policies? What's influencing that? The support for the intervention, is it there at a government level perhaps? Is there funding bodies in place to be able to support a scale up of an intervention like Sheds for Life? So to understand how we look at our implementation outcomes, we use different levels, so individual, provider, organizational systems across different contexts and settings. So we do that by applying different implementation frameworks to understand that. So things like our inner setting or outer setting. Try to identify the various facilitators and barriers that influence them, and how we can strengthen the facilitators and overcome the barriers to successfully scale up and, I suppose, sustain Sheds for Life. So the evaluation takes on a mixed methods approach, but it's very much pragmatic in that it's being implemented straight away into the real world setting of the sheds and the variable setting of the sheds. And COVID is, I suppose, now a particularly significant barrier in the real world setting that we need to overcome. So COVID has had an impact on Sheds for Life in the sense that we had originally tested it at a phased basis across 4 counties, so 2 counties and then a further 2 counties. Our next stage was meant to be in September, so around now, but unfortunately we cannot do that because of COVID, so we've postponed it until February. And we're dealing, I suppose, with a vulnerable group of men in terms of their age, and then their COVID risk, but also in terms of a cohort within them probably being a hard to reach group. So we have to use gender sensitive strategies within Sheds for Life to engage these types of men. So maybe men that may have had an aversion to healthcare, and there's a whole other host of reasons why they may not want to engage. But Sheds for Life works because it is delivered in a safe, familiar, convenient environment, but it also has the social support of other men, and it's a male only program as well. So there's a safety in that. Many organisations have gone online with their initiatives, but Sheds for Life works because it engages men in that way. And a lot of the men that we may be trying to reach, so they're real hard to reach men that we want to access as a, when we implement Sheds for Life, they probably won't be as forthcoming to get online. They may not have the digital literacy skills. They may not even have Wi-Fi. They may have mental health issues. They may have anxiety that would make that kind of a scary territory for them to engage in. So we need to be aware of all of that as well. So really what we want to do is try and implement Sheds for Life face-to-face as much as we can and adapt it then so that it's done safely. So really, when we're looking at implementation, we always look at different stages and we work together to identify them. So we look at characterizing the implementation setting and identifying our stakeholders. So all of that's done. But in real work settings, I suppose evaluation is never linear. So it's an iterative process. So really what we're probably going to do now is go back to step 3 and identify again our implementation barriers and facilitators in light of COVID. So what's affecting COVID at the individual level. So there's probably going to be a level of fear and anxiety in the men providers, but they have a limited capacity to implement it. What's going on within the organisation, and I suppose government guidelines then in the wider context. So how do we overcome them? What practical solutions can we put in place to ensure that we can still deliver Sheds for Life? We may need to source larger spaces. We may need to take some of it outdoors. Maybe a small amount of it can go online, but it's something that we will work together to figure out. One of the opportunities that did come out of the COVID piece, I suppose, is that we were in a good position with the Sheds for Life research to have data on the impact COVID is going to have on the men. So as we were following the men over time, we were following around 420 men over time, and we were able to, at the 6-month point, they were experiencing COVID, whereas a previous cohort that had gone before them at the 6-month point had not been. So we were able to use that as a comparator to understand the impact COVID is having on men that have gone through Sheds for Life, and I suppose looking at Men Shed members more broadly. So some of the biggest impacts that would have come out of that then, we've recently just put this in the paper, so it's been published in Health Motion International with myself, Niamh Murphy and Noel Richardson. So what the biggest kind of, I suppose, findings that came out of that is that both cohorts would have experienced an increase in things like their self-rated health and life satisfaction after Sheds for Life, but there was significant decrease in those types of outcomes for those who were experiencing COVID. There was, life worthwhile ratings, so the extent in which they feel things they do in life are worthwhile significantly decreased during COVID. Loneliness scores significantly increased during COVID, which is one of the more poignant things, I suppose, to come out of it. So the sheds were very protective of social isolation and loneliness. Now that they're closed, I suppose it's a big loss to a lot of the men, particularly those who are living alone and a little bit more isolated. So those who actually fell into the lonely category increased from 1.4 to 29.7%. So it's a stark realization of the impact COVID is going to have on older adults, I suppose, more broadly as well. And those who were lonely, so those who actually had higher loneliness scores and were categorized as lonely, were also more likely to have lower life satisfaction, mental well-being, and lower physical activity levels too. So I suppose it's worth knowing from a public health perspective that those who are more vulnerable, COVID is going to have a much more significant impact on those, and how do we tailor our interventions accordingly to help those that are more at risk of isolation. And also in terms of physical activity, we know that those who actually, as a result of this, we know that those who were already meeting the physical activity guidelines are more likely to become more active during COVID, and those who were not meeting the guidelines are more likely to become less active. So again, that's important, I suppose, to know from a public health perspective, and that those who are already inactive are more likely to become less active again. So we really need to encourage that cohort back into physical activity and guide them some way during COVID, I suppose, and post-COVID. So there are some of the broader findings. The paper will be coming out soon, so you'll be able to read that. And if there's anything you want to ask me about or follow up with, then feel free to give me an email anytime, and Niamh will happily pass on my contact details, I'm sure. So thank you for listening.